Right, let's get on to the what is going to be one of the issues at the heart of this, which is communication and consent. This is an intimate procedure. It's a difficult one to discuss. Maybe it's fairly apparent to a patient why it should work, but what is the correct approach to communicating and getting consent for internal examination and treatment?
As I say, the majority of patients that I'm treating are coming to me specifically because they've been sent. You had treatment from him, you've had that, you've had this, so they're being pushed into that. So if you like, it would be very foolish to take that consent as implied. There is no such thing as implied consent. Implied consent really is the sort of thing that you want to avoid even thinking about. Consent is consent. You either consent to something or you don't. Right. And yes, it's an intimate area, but putting your hand on somebody's shoulders could be an intimate area. So I'm making...
Even the person who thinks that's intimate is going to think there's a world of difference between that and sticking your finger up their bottom. Absolutely.
So if you like, the more intimate the area, the more I'm going to be saying. But consent is consent. Now, when a patient comes in to see me, I have my own protocol, which is take the history, do the examination, standing examination, do all the active movements, etc., indicating a lumbar disc problem or otherwise, with various different tests that I use, and then the coccyx provocation test. That coccyx provocation test requires verbal consent because the patient's fully clothed, they're sitting on the table, you explain to them, I use my hands in the way that I used them before to show what needs to be done. How do you feel about that? Is it going to hurt? Yes, because the test has to be positive in order for me to put my finger in your bottom.
Well, more to the point, if it hurts, then it's a positive test.
Exactly. Yeah. And if it doesn't hurt, then it's something else. Oh, well, okay, yeah, fine, yeah, you carry on and do that. But patients understand what osteopathy can do if they've been referred. Oh, go and see Dr. Sandler. He does these internal techniques, and he's the expert. So they've already been pre-warned, and it will be very rare. And if that test is positive, okay, at that point we break. I have a consent form, and by the way, if anybody wants a copy of my consent forms, then look me up in the register, sandlerosteo@gmail.com, free gratis. I'll send you a copy.
If you wouldn't mind sharing it with me, I can send it out to everybody who's attended this broadcast, which is useful.
That's dead easy. I'll send it to you by email. And then you just put your own name and address on the top of the paper. Yeah. But that says quite clearly that I've had the problem explained to me.
Yes.
And I am happy to proceed. It then says, do you want a chaperone? Mm-hmm. If you don't want a chaperone, you sign to the fact that you don't want a chaperone. And I know the GRC has said in the past that the consent form doesn't necessarily always have to be used because people can be intimidated. In my practice, it's always used.